I did want to take a brief moment and introduce Steve. I think I've already introduced her to you, but for the rest of the committee members, we have Kelly Sheets on today. She is going to be helping me tackle all the MAC and TAC meetings moving forward. And then when I'm on maternity leave in March, she will be your main contact until I return.
Welcome, Kelly.
Thank you. It's a pleasure to be here.
And congrats, Aaron.
Thank you.
It's exciting.
It is very unexpected, but very exciting.
There you go.
Let's see here. It's just 9:01, so we can give it a minute longer, see if we have anyone else trickle in. So. And Kevin is logging in. You have a quorum.
All right. So he's on, right?
He was logging in. Let me make sure he got in. Yes, he's logged in.
All right, very good. So that gets us 7 of 12, right?
Yes, sir.
Okay. Well, welcome. Glad you're here. We're counting quorum. We have 7 of 12. I'll go through the members so we see just in case we miss somebody. And then we'll go from there and start our meeting. James Daly. Dr. Ryan. Dr. Smith Stevens. I saw her earlier. Brandon Harley.
Present.
Hey, Brandon, how are you?
I'm well. How are you, Steve?
Good. Adrian Bush.
I am here.
Hey, Adrian, how's life?
Great.
Good.
Glad to be here.
Yeah. Van Ingram.
I'm here, Steve.
Hey, Van, it's been 3 or 4 days since I've seen you.
Yeah, exactly.
Evan Smith.
Present.
Hey, Evan, how are you? Things getting back to normal up there, kind of?
Yeah. We're sliding into the a normal state of normal.
Yeah, there you go. Christian Porter. Kevin Sharkey.
Present.
Hey, Kevin, how are you?
Good. How are you?
Good, good. Glad you're here. Angela Darcy. All right, and Brandon Thomas. All right, well, we have 7 of 12, so we are ready to do business.
Steve, we don't have Shannon Smith Stevens on. I don't.
No, what happened? She was on earlier.
Let me scroll back through just to make sure I didn't miss her.
She didn't answer.
I'm not seeing her. Maybe she had
No, I
to fall
didn't.
off and she'll call back in. If she pops back in, I'll let you know.
All right, well, we won't worry about the minutes quite yet. So we'll come back to that. So we can't do the minutes, but you have it in front. Those are my minutes. You already got the package that Aaron sent out with the court reporter information, but I think this is a bit more useful for me. This is what I use to give the report to the MAC, and that's next week, right, Aaron?
Yes, sir, on the 17th.
So it's always good information if you have a chance to participate on the MAC. All right, Leslie Hoffman, DMS update. I suspect the messages we're still waiting.
Yes, good morning. Yes, I'll go ahead and go through it for anybody that hasn't heard my
Yeah.
spiel before, but just generally in Kentucky, it was time to renew our overarching 1115. And with that renewal request or an extension request to the demonstration, we renamed it to Team Kentucky 1115. And it was submitted on September the 30th. And the SUD piece of that was updated at the same time per the request of CMS. It was
And
actually
what is the SUD piece of that? Tell us that.
the SUD amendment for the services that we cover under the 1115. So that piece was updated at the same time, even though it was not necessarily up for renewal. They asked us to renew it with the 1115. So I'm sorry.
And that's the residential piece, right?
That's the services we already have for SUD that is covered under the 1115. And so, and then also within that, the SUD incarceration amendment that we submitted back in 20 is also embedded within that request. So all three of those pieces are kind of together, and nothing can be approved until we get the big Team Kentucky 1115 approved for extension. The federal public comment ended. You probably heard me talk about that on the behavioral health TAC last week. The federal public comment actually ended on 11/3. So that was just last week. Staff did say that they looked at comments, nothing substantive so far, just some basic cleanup, maybe some things related to budget neutrality and things like that, but nothing of concern right now. And then we are following up either today or Monday for our regular meeting with CMS to talk about next steps. I can't give you a date on the approval because they've not given me any additional information. I don't think they want to pin themselves down to a specific time period. The Team Kentucky 1115 does run through September the 30th of 2023, but we're required to submit everything a year ahead of time. So again, Steve, I'm sorry that I feel like a broken record. I say that all the time, but I will let everybody know as soon as I get any information from CMS.
I suspect we'll hear you holler when that happens.
I'm very excited about this. Like we want this to happen, right? So yeah, very excited, and I'll let you know as soon as I hear something.
Okay.
Leslie, do you still feel like maybe our corrections 1115, all this will be done approved at the same time?
We're hoping that, yes, the incarceration amendment, since it was in prior to and now it's embedded in the full request, we do hope that they will approve it all at one time. And they've not said no. We've kind of asked them that just point blank, and they've not said no. So I'm really hoping. Now, to let you know, if that happens, there is going to have to be like intensive coordination as far as communication. We've got to develop an implementation plan. Van, I'm sure you were involved with the SUD implementation plan to get it off the ground and started. We have lots of initiatives with our AOC as well as DOC to get out there and get the message, and DBH to push the message of what the mission and values are for that particular amendment. And we're going to speak to the circuits for the judges. We want to get out there and talk about our mission and what we expect, and that, you know, no extended time on that was never intended for extended time, or that more folks would be incarcerated to receive treatment. That of course is voluntary. So I just wanted to let you know that we've got lots of communication that will be going forward after that.
Look forward to it.
Yeah. And typically, how long does CMS take to approve the 1115? I mean, I guess they have a year, right?
Yes, this one's a little bit different because it's also unfortunately incorporating that renewal of the big overarching 1115. So it might take them a little bit longer. I think with the SUD amendment that Van was part of, I think that may have taken 2 years. But again, that was an amendment kind of at the time like our incarceration amendment is. So I'm hoping that we can hear something fairly soon. And again, we're reaching out to them for our monthly meeting. So maybe I can have an estimated date, but they've not pinned themselves down. I'll be honest with you on a specific timeline.
Yeah, that original SUD waiver ended up being part of that court case, and then it got separated out. So it took forever.
Okay. And the current one we have is really in effect through next September, correct?
That's correct. And the SUD portion is actually just in the third year of 5, but they
Right.
asked us to renew it at the same time. So
Right.
timelines are a little bit off. Actually, it would be nice to have all of that together,
Yeah.
right? So that it moves together, flows together a lot easier and simpler.
If it gets approved, and let's just pick 6 months as an example, right? That gets us through the end of April, we hear it's approved. Does it become operational immediately, or does it become operational 9/30/23?
I'll have to check on that, Steve. What I know we'll be held accountable for an implementation plan on the incarceration side. So the dates might vary, honestly,
Okay,
for implementation.
okay. All right, thank you.
No
Anybody have
problem.
any questions?
Steve, I did ask Leanne to be on today to give you a few updates as well.
Yeah. Yeah, we'll get, I just want to see if there are any questions about this piece. Okay, Leanne?
Hey, good morning, everyone. So as of 11/7, there are 1,687,963 Medicaid beneficiaries. Of those beneficiaries, there are 20,241 that are incarcerated. And we are continuing to watch, and we're continuing to see that once someone has been released, benefits have been turned back on within 3 days. So very
Yeah,
promising.
Leanne, I had a call yesterday with an MCO and the CMHCs, and one of the CMHCs is getting denials and recoupments based around this issue. And one of the MCO said it's the 834 data is not current, so they have to recoup. Now these are going back, but they're still concerned that it's not playing out within that 3-day time frame, or some reason the MCOs aren't getting the 3-day time frame. Is that possible?
I'm not sure about that on that end. I just know that I continue to process emails that come through. We know that with the APRAs coming in, that sometimes the data goes back and changes things it's supposed to be within a 6-month window, but it's not happening. It's happening outside of that, which is causing denials and recoupments. But we are processing those as soon as we get those. Everyone is aware of the problem, and we just haven't been able to pinpoint the correction for that.
Okay. Yeah, we discussed that in fair detail yesterday. And it was the Pennyroyal Center, and then Mountain weighed in as well. They're having the same issue with outstanding. And the folks from the MCO, they were saying that the data set they get from you all isn't always current. So is that the 6 months time frame?
Right. Well, that's what happens so APRA's, talking to the system, our eligibility system, when someone's released and someone's incarcerated, it's supposed to be within a 6-month window. So
Okay.
it's doing it outside of that 6 months window.
Okay. And the individual, I had this conversation last month as well. The individual still has to contact DCBS, or is that now automated?
It is automated, but the individual still has to contact DCBS.
Okay.
Yes. So hopefully, though, that now that life is kind of returning to almost normal, that people are being able to get into the facilities, and our connectors are able to do the pre-release classes, which I don't think that they've been able to hold those like they used to. So everyone that's
Yeah.
released, let's say in December, there'd be a meeting to come together and tell you, oh, okay, connectors still aren't allowed in every facility. Courtney said, thank you. So
Mhm.
typically those will be able to meet, and then they would be given instructions of what to do once they're released.
Okay. Yeah.
Steve, Courtney with Aetna dropped in the chat that connectors
Yeah.
aren't allowed in every facility. I wasn't sure if you saw the chat.
Yeah, I appreciate that. Thank you, Courtney. Yeah, I know one of the centers actually had a grant to do that, and they have not been back in. May have been the Pennyroyal Center. Got some facilities in West Kentucky. Does the same process work, Leanne, for folks coming out of local jails?
Yes. Well, I'm sorry. I don't think so. It's just going to be in the state-run facilities unless someone can correct me. Unless they're, I think if their DOC has an arm over there and that they have, state folks in there, but it's just going to be for the state. Mhm.
So local jail, they got to call that number, right?
Yes.
I agree, Courtney. I would think the local jails are a majority of people. Thanks for that. So maybe some of those issues that the centers are having, and probably other providers, it may be folks coming out of local jails, not necessarily DOC facilities. And you don't know, this is way down in the weeds, and I can't help myself, because there are some DOC inmates at local jails.
Correct.
Yeah, that's all Class D felons.
Right.
People serving 1 to 5. And then Class C felons that are serving 5 years are all by statute required to be in local jails. And if there's one place where we miss delivering good services, that's it. It's people being released from our full service jails.
Right. Right. And if they're a DOC, if they're a state inmate, right, Van, do you think they're getting reported or not?
Yeah, I think we got a pretty robust reentry team at DOC. But, bear in mind, those are all C felons, B felons, and A felons. So the majority of people that get incarcerated are Ds.
Yeah.
At least half of our population is in those local jails. I met with some folks last week at Northeast Kentucky that have kind of taken on the task of doing reentry services for folks in about 7 or 8 jails there in Northeast Kentucky. We need more of that for sure.
Yeah. Because there's a lot of local jails, right?
76.
That's what I thought the number was. All right. Well, that's good to know. Maybe we can come up with some plan for that. But the waiver, Leslie, wouldn't be necessarily local jails.
Leanne, do you remember what the credentials were for the facilities, just DOC related?
Yes, ma'am. It was state inmates,
Because
DOC inmates.
we're partnering with them on some current programs that they've established
Right.
to increase capacity and meet the needs that kind of have been limited for a while.
Yeah, so DOC has a presence in 22 of those 76 jails. Our hope was if we got the 1115 approved, we could greatly increase that.
Okay. All right. Very good. Any questions about that? I've said this before. Once that approved, I think our work really changes as a TAC.
I do too.
Any questions? All right, the next thing is service and supports following local jail release. I think we've already kind of talked about that, right? Van, what are those folks in Northeast Kentucky doing?
So they're going in and meeting with misdemeanors and felons. They just started doing felons. They have been doing misdemeanors. And have a peer support specialist come in and discuss what services do you need upon release. Are you Medicaid eligible? Do you have housing? Do you have transportation? Do you have employment? And working with those individuals that we know are going to be released to try to have better outcomes when they are released, to have a plan. And I was really they're working on a HRSA grant, but I was really impressed last week with what they're doing and what they plan to do.
Okay. Courtney, you had a question, I think, Courtney Ham?
Yeah, I'm sorry. Sometimes I don't know if I can chat on the or talk.
There's
Because
no rules, Courtney.
okay, great. So if there are new programs, I would love to hear about those, especially if the Northeast Kentucky people have a name. Just so we can spread the word about that those programs are out there. Because, the majority of the 76 jails in Kentucky are full and overfilled. So people are coming out every single day. And so if there are new programs, I would love to hear about them. So, or if there's a place where that information is being stored, I would love to have that so we can spread that word.
Yeah, Courtney, I'm pulling off the side of the road. But if you can email me, I'll connect you with those folks.
Okay, thank you, Van.
David Crowley would like it as well. If you want to send it to me, Van, well, however you want to do that, I guess we can get email addresses and get on the distribution list. So.
Yeah, I'll get you that information, Steve. I'll be back in the office later today.
Okay. And we'll send that out to as many folks as we can. David Crowley.
Steve, if you want to forward that to me, several of the MCOs are asking for that information. So I can always pump that out to them.
We'll do that. Okay, we'll get that to Erin. She can get that out to the group. Seems like a lot of people are interested in that. That's good information, Van.
Yep.
Evan, up there with Apple Red, are you involved in jail release stuff?
Yes.
What are you all doing?
First off, as my coworker Casey and I've talked about on some of these prior meetings, the basic model that we have is that we have a partnership with one of the community mental health centers in this area, Mountain Comprehensive Care Center. So they have a social worker, and then Casey, who I believe is on here, is an attorney with us here at Apple Red. And so what JR, the social worker at Mountain Comp, he tries to meet with everyone in the Floyd County Jail, obviously who wants to meet with him, and no one has to talk with him, and to understand, kind of what's their expected release date to the degree that people know that, and what civil legal needs may they have, or what social service type needs may they have. And then especially for when there's a civil legal need related to that, that's where Casey can potentially step in. And so we've done really a variety of things to help people. The most common are helping them get identity related documents, birth certificates, state IDs, etc. That's, as I think most of us that work in this area know, a very common need, and makes a really big difference in terms of on the day that people get out, the likelihood that they're going to be able to get connected and really get the help that they need from some of the other social service and public benefits programs. But we've also helped people with tax issues. We've figured out that there's people need some help with divorces, and anyway, there's been just a variety of civil legal needs that people have had that we've been able to kind of identify while they're incarcerated, and then get at the point that when they're being released, they can kind of get better connected and really hit the ground running. So that's the really short, basic version of it. And Casey could kind of give more detail and also say it more eloquently than I can.
That was good information, that presentation. And you do obviously Medicaid eligibility as well?
Trying to think of any cases that we've had where that's been a problem, but
okay.
I think that if anyone was having trouble with Medicaid eligibility, yes, we'd be happy to help them sort through that.
Okay, super. Appreciate that. Anyone else on the call of any contact, release stuff from local jails they want to share? Okay, I skipped the MCO updates. This is just going to be a recurring agenda item. Let me just go through, and there may not be, and that's okay. Don't feel obligated to. So, do we have anybody from Aetna?
Yes, sir. I'm from Aetna. In your chat. My name's Courtney Ham. I'm the crisis administrator here at Aetna Better Health of Kentucky. I don't necessarily think we have any updates. I did actually meet with the Apple Red program, however, to talk to them about that Medicaid piece that you were asking, because it wasn't necessarily a part of the form. And we would
Right.
just encourage any sort of new programs to just ask that question. So then they can get connected with their connectors and then get instated within MCO or maybe newly instated, just to prevent all those things like, I don't know, medical bankruptcy. There's just so many things that can be
Right. And
prevented.
the question is the Medicaid question, right?
Right. Yeah. So I did meet with them. They're running a great program. They've seen at least 1,000 people in less than a year. So we know the need out there is great. As far as Aetna is concerned, we're still running our Start Strong reentry program. And that's going as well as can be expected. We're excited about the SUD and things getting started in that way and working in a new capacity.
Yeah, so are we. Thanks. What about Anthem?
Hello, Steve. This is David Crowley, Director of Behavioral Health.
Yeah, how are you?
Doing well. Good morning. At Anthem, we continue to work and coordinate with our reentry population with our dedicated case management activities. We've also really ramped up over the past 2 quarters our empowerment team engagement, which they work to help coordinate all social determinants of health needs, whether it be rental arrears, utility arrears, that type of thing. We really don't have a significant population size at the moment, but we are still working along and coordinating with everyone. So,
All right, super. Thank you. What about Humana?
Hi, everyone. This is Kelly Bendorf. I'm with Humana. The same as everybody else, we continue to work with our release members that we're getting. We reported last time that we're having some low volume. We did have 7 members that were released that we attempted to contact in the last 2 months. And we're coming into some barriers with that. We're still having some difficulty reaching people. Also, what's good about what's happening is they're getting a lot of services upon release. So they have a lot of things already set up, which is amazing. But we've also had some people decline our care management services due to feeling like they don't have any needs. So kind of some things that we were thinking of is that we think that, and I think, Leanne talked a little bit about maybe not having those connector meetings on site. Like if they, our released individuals knew more about what we were going to be doing in our contact and how we can assist them before they get those phone calls. I think that could really help them a little more. Also, we have field care managers, so we're all out in the field now. We've started that for the last 6 or 9 months. We've been going out to the field. So we would love to meet with members in person in the field and try to really help them connect and reduce barriers.
Super. Thank you, Kelly.
Thanks.
Going through my list alphabetically because that's what I like. Passport by Molina.
Yes, this is Mark Zock. I'm a manager with our case management team. Pretty much what everyone said, we're seeing low volume. I think we got 2 new members through the NGA pilot specifically this month. One we've been able to contact, one we're still trying to contact, but we're also finding quite a few members that come to us through our state guardianship. And we've also have several members that are in our SUD model of care. I have noticed as of late that the becoming active more quickly. It's happening more where by the time we get the information on the members from the pilot, that they're already enrolled back with Passport. So that has not been the same problem it's been in the past.
Good. All right. What about United?
This is Eric Davis with United Healthcare. I'm the member advocate, and we have a kind of accidental good news story. So we like those. We had a newly released member approach one of our HR reps at a consumer event and had received treatment at UK hospital right out of being released and was getting bills and things like that. So the rep was able to get them over to me, and we were able to get him a card and get his claims paid. And he had a very good first experience with managed care organization.
Good deal. Thank you for that. And WellCare.
Yeah, good morning, Steve. This is Stuart Owen from WellCare. And by the way, that is a good story, Eric, from United. That's a great story. Just a couple of really minor things are really more related to barriers to employment. And we're probably not the only MCO, but we pay for criminal record expungement as a value-added benefit. And we also pay for the state ID card as well. And again, we're probably not the only MCO, but those are two huge barriers, obviously, for individuals, from incarceration going back to society. So those are value-added benefits we have. So I just wanted to mention that.
Okay. Thank you. Write notes, people. I'm slow. Any questions for our MCO partners?
No. Hi, Shannon. My name is Stephanie Koenig. I know that member services, Eric had just spoken from United, but I did want to introduce myself. I am the new behavioral health director here at United, and will be participating in these meetings.
Welcome, Stephanie.
I'm sorry, Steve, this is Paula from WellCare. I was on mute. I just wanted to say we do also have some care managers going out into the field now, so we are able to maybe meet these members where they are. And we're not having any issues currently with any released members.
Okay, great. Thank you.
And Steve, I did want to report out, I know Eric did speak, but I did want to kind of piggyback on what the other MCOs have stated. Today, currently, right now, we're actively working with 8 individuals, but we are seeing similar challenges as well. I think in a 3-week period, there was 20 members that changed MCOs upon release, and just struggling to kind of contact some of these individuals either with incorrect data after the release, unable to contact, and some, when we are reaching out and offering the case management services, they're declining participation oftentimes, either because they don't have stable housing, moving, so they're just not actively engaging in the case management services. What we do have a lot of connections with and our referrals is either to dental services, cell phones, food resources, and being able to assist with housing. So I did want to provide that update as well.
Okay, thank you.
You're welcome.
I have just one more comment on that. And
Yeah.
Stephanie, I'm glad you're here. I do encourage our reentry coordinators to reach out to probation and parole in the area and reach out to Department of Corrections. I think sometimes that people who are reentering think that there's kind of too many cooks in the kitchen, right? If they're already following probation and parole, they might not understand why case management through their MCO might be also helpful. So just to keep that in mind, and then, we don't always get, we don't always get good feedback with probation, just meaning that sometimes they want to work with us, sometimes they don't. That's okay, that's their prerogative. But we're just, when we reach out, we're just reaching out on behalf of the member. So just to say that piece, because it is a lot of coordination that happens, especially when someone's getting released.
Yeah.
Stephanie, would it be helpful to pull together a meeting with our reentry folks and P&P folks and the managed care companies representatives?
I definitely think so. Sorry, Courtney. But yes, this is Kelly from Humana. I definitely feel that would be the case.
Yeah, I
Okay.
think that would be helpful as well, reunite it.
Yes.
Yeah.
Okay, I'll get with Aaron. Let's try to pull something together.
And that will help those folks, right?
Yeah, I mean, we need to be working with the MCOs. And if there's something we can do to encourage probation and parolees to accept that extra case management, that extra help, then we need to be doing that.
All right. Good deal. And you'll take the lead on that, Van?
Yes, sir, I will.
All right, just checking. All right. I'm gonna put your name down on it.
My name's all written down all over the place, Steve. One more place will matter.
Correct. You lead the league in meetings, I think. All right. Anything else on the MCO topic? We touched upon barriers to employment. And that's a topic I put on here. I think that's one of the real challenges folks have. And we heard from WellCare that they assist with expungement, right, Stuart or Stephanie, and IDs.
Yes, we pay for the fee to get the assist with getting it done, and then the state ID card as well. You know, you got to have an ID card for anything in life.
Yeah. Okay. Are other MCOs doing similar things?
Steve, can you hear me? My mic's been messed up. I'm sorry.
Yes. Yeah.
Okay, cool. So I'm Bethany Fomby. I'm with Anthem as well. I actually manage the empowerment program that David was talking about earlier, where we focus one-on-one with our members on their SDOH needs. So we also offer criminal record expungement, but we also know that, you know, to be eligible for that, some time has to pass typically. So while we're waiting on that, we also work on all SDOH needs, including employment, whether that's connecting people to, you know, the right resources for employment, or focusing on the barriers around employment that aren't necessarily specifically employment. So housing, food, education. You know, we actually have, I know the state pays for the first GED test, but we do have the option, it's one of our VABs for GED retest vouchers as well. So kind of full circle, we try to tackle any and all SDOH needs that the member might have.
Okay.
It's Mark from Passport. We're also doing the GED stuff, and we have quite a few dedicated members to SDOH issues.
Good deal.
Hi,
Anybody else? Yeah.
Hi, this is Kelly again from Humana, and we also have a really robust population health team who also does the same thing, and we do all kinds of ways to reduce any sort of barriers that the member might have through social determinants of health. So whatever need they might have, we find ways to help them meet those barriers and challenges.
Thank you. Anybody else?
Oh, sorry, go ahead.
I was just gonna say, I don't know if somebody from United wanted to say something, but I know they have a pretty robust expungement clinic where they've served over 2,000 folks, and I think about a 75% success rate. So I don't know what else, but I just wanted to throw that out there.
Okay, Eric or Stephanie? Maybe they've, I don't know. Courtney? No.
I'm not able at this very moment. Hi, this is Stephanie with United to speak to this. But I will follow back up with my team.
Okay. It's one of the challenges being a newbie, right, Stephanie?
I mean, it's only day 3, but.
There you go. Yeah. That's all right. Etna, Courtney?
Yeah, we also have those GED test vouchers, and we do have a dedicated case manager specifically for reentry services. And we also spend a lot of time talking about social determinants of health and definitely have a team that's focused on that, as well as a homeless initiative team or houselessness. So individuals who are facing a housing crisis, who are often coming out of reentry, those things overlap for us. So we have that also happening at our plan.
Yeah. All right. Do any member of the TAC have concerns or experiences with employment barriers? And we hear all the time, employers can't find people to work. It's going to be a great opportunity for some people. All right. Next, round robin member updates. Anybody have anything they want to share with the group?
I mean, to lighten the mood, we do have a really great success story. I do have one of the case managers on the call from United, if you guys would like to hear some of the success.
Sure.
Penny, are you still on?
I am still here. I do have a success story. I have a member he's a 50-year-old male who was in the reentry program, of course. He was at Keaton Corrections for many months, and he was able to get health care. He was able to get his behavioral health provider, his primary care provider, as well as he was able to be moved from Keaton Corrections to an adult kind of like foster care situation. So he's now living in a home that he likes. He does have part-time employment. He is on his medications and able to continue with medication adherence and is doing really well.
Good deal. Thank you for that.
Thank you.
And we'll highlight a success story, or we'll try to every meeting. All right. Anything else, folks? Said it before, I have no problem finishing early. Does anybody have any future agenda items? I take that as a no. All right, we'll work on that. And Aaron, our next meeting is January?
Yes, sir. Sorry, I had a hard time getting off mute.
January 12th, 2023. My gosh.
Aaron, this is Van. Will you help me pull that meeting together to make sure we get all the right folks from the MCOs at the table?
Absolutely.
Yeah,
Okay,
Aaron's been collecting those emails, Van, as we went, so.
Yes, and I can email that to you. I've been cutting and pasting them into a Word document. I had most of them, but there were a few I didn't, so I can email that to you guys.
Good deal. I'm on a tablet on the side of the road, so I don't have
Yeah,
to
we
look at
understand.
the chat. Yeah.
And Steve, this is Evan. As a housekeeping matter, did we ever approve the minutes?
Well, we didn't have a quorum.
I
We
thought
had a quorum, then we
Oh.
lost our quorum.
Oh, okay.
So yeah, thank you for that. Yeah, so we got to have 7, and we had it briefly. I should have jumped on it as soon as we had it. And then we lost 1 member, so we went down to 6. Right, Aaron?
Yes, sir.
But I appreciate that, Evan, keeping me on track. So.
Steve, if you're interested in January 2, we might be able to give you an update as to where we are with SMI SED waiver. And also we're working on a component for employment and housing, social determinants of health type of issues, not necessarily the housing, but the supports that will surround it. So I could give you an update after that because we're looking at December to have a
Very
draft.
good. Appreciate that, Leslie.
No problem.
All right. If not, we are done. Motion to adjourn.
So moved.
Thank you, Van.
Second, Brandon.
Thank you. Thank you.
Thanks all.
Well, take
Everybody
care.
have a great
See you in
afternoon and
January.
happy holidays.
Correct.
Yes.
Enjoy your holidays.
Thank you.
Thank
Everybody have a
See
good
y'all.
day.
Thank you.
Bye-bye.